Welcome once again all. Sorry for the disturbance. Let me continue with the Ayurvedic perspective of myopathy. As these all I have been explained, 2 points are there. The primary signs must be from the muscular part and there must not be a primary involvement of the nervous system. That is the criteria for diagnosing a muscle disorder. I am skipping a few slides and this is a clinical approach I wish to explain. If a patient with muscle disease is approaching you, a certain things must be in your mind, whether they are having negative or positive symptoms and signs. Are there any precipitating factors that trigger the muscle weakness? Is there a family history of a myopathic disorder? What about the course of the disease and also the onset? Are there any associated systemic symptoms or signs? And what about the distribution of weakness? From the history itself, we'll be having a idea of what about the disease is having. Let's take an example. If the patient is having a family history, you can go for conditions such as muscular dystrophies. And if it is having a positive medication history from the part of a patient, you can go for some statin-induced or steroid-induced myopathy. Similarly, an understanding must be there from the history itself. And coming to the approach to progressive muscle weakness, this is the area I wish to highlight. In myopathies, almost these muscle weakness must be symmetric and they will be having a specific distribution. For example, ocular bulbar myasthenia gravis will be having weakness on that area only. While in nervous system disorder, there may be somewhat generalized distribution and in some cases, it may be asymmetric as well. This is the general approach we are using. I am not mentioning the individual condition. These are the variety of presentations we are getting as far as myopathy cases are concerned. It may be a muscle pain or fatigue. It may be proximal and symmetric. There may be some disturbance in the gait, such as rattling. There may be some contracture deformities, and also there may be myotonia, means altered tone in the muscle. These are usually presenting by the patient. A lot of investigations are available. The main thing may be the creatinine kinase, which may be 50 to 100 times, may be raised in some cases, and there will be alteration in the electrolyte imbalance, particularly in the acquired myopathies. And there are certain other investigations including EMG, muscle biopsy, nerve conduction study, and ECG. These are not highlighting as I am skipping to Ayurveda part. And what about investigations? A lot of gene abnormalities can be detected as far as modern medical personnel is concerned. So what about after the detection? Nothing is happening. They'll be going for a diagnosis and the treatment is restricted to either corticosteroids or some other general medication. This is the area where Ayurveda have to interfere. As per Gananath Sen, a lot of diseases will be involved in the coming period. Yes, what he is mentioning is Purana Praviliyande, Navina Pradurasati. What I believe is that myopathy is not explained as such in Ayurveda, but there are similar references which we can add or contribute to the pathology of myopathy, where Adi Bala Pravarta is explained, Mamsa Dhatu and its functions like Leba, Bala, Medo Pushti is explained, Peshi is explained, and genetic factors lead to Dhatu Dushti. These all are capable of explaining the pathogenesis and management as far as myopathy is concerned. Coming to Adi Bala Pravarta, it may be due to Dushta Shukra Shodhida, but what I wish to highlight is that this Adi Bala Pravarta is capable of affecting up to Shukra Dhatu. Each and every Dhatu may be involved depending on the extent of the Samprapti, and it is transmitted through generation and it becomes almost Duschigilsya or almost Asadhya, and almost all the myopathies may be Tridosha as well. Peculiarly the inherited myopathies come to this group. I am going to the next point. The contributory factors include two types of factors. One which is modifiable, which includes Nidana for Doshakopa and Agnimandya, where our Shodhana and Shamana Chikitsa may be working. The other one is non-modifiable factors, which may be the hereditary or genetic one, which is the Dhatu Agnimandya, where we are having no other option than the Rasayana. So by putting these together, we can manage myopathy to an extent and improve the quality of life of the individuals. Coming to, for example, let us see the case of myotonic dystrophy, where we can see that not only Mamsa Dhatu, all the Dhadus are involved. It starts from frontal baldness and it ends in infertility or testicular atrophy. What I wish to say is that in myopathy, Mamsa Dhatu is not the Dhatu involved. All the many other Dhadus are involved as per the extent of the Samprapti. Coming to proceeding with the Chikitsa, as I have told that this almost are dus Chikitsa. While coming with such a disease, what is mentioned that there is a chance of Artha Vidya Yesso Hani for the physician. So what you have to do is that proceed to the diagnosis, explain the prognosis. If they are convinced with the same, proceed with the protocol, particularly the inherited myopathy. Secondary myopathies we can manage as we can reverse the pathologies available with the myopathies. A lot of conditions are met within clinical practice. I am not going to individual symptoms, maybe from Duchenne's muscular dystrophy to myasthenia gravis and also acquired myopathy, which is drug-induced, thyroid-induced, etc. Let us see Duchenne's muscular dystrophy. All of the delegates I know, they are aware of the symptoms. So I wish to examine the Ayurvedic part only. While analyzing the symptoms of Duchenne muscular dystrophy, we can see Kritsra Uddaranam, Padyo Sadanam is mentioned in Urustamba, Ardhakaya Akshamada in Pakshagada. Mamsa Balakshaya and Asti Majjagadavada, Prasarana Agunjana and Snayagadavada. What I wish to say is that by incorporating the management principles of all these conditions or many of these conditions, we can prepare a protocol for managing the myopathies. And it is not only the management of Mamsa or Majjagadavada which is suitable here. Also, you can go for some Avarana Chikitsa as well, as Gadi Banga is the feature of Kaba or the Vyana. Coming to the prognostic factors, while explaining Pakshagada, Acharya CISSA is explaining that Atma Vanda is one of the good prognostic factor in Pakshagada Chikitsa. In muscular dystrophy or myopathy also it is very correct. And also a patient with atrophy, loss of movement are said to have bad prognosis. And also as we all know, Shosha is considered as Asadi Lakshana in Vadavyadi, which is very much dominant in the case of myopathy. So a lot of good and bad prognostic factors are seen as far as myopathy is concerned. Coming to localization and treatment. While explaining Vata Shonida, which is a generalized illness, Acharya CISSA is saying that Pani Gade, Kapa Pittari Bande, Vamana Virejani. Pada Gade, Vadana Bande, Asthavana Purvaka Manivasanam. So what I wish to say is that you must frame the protocol as per the site of distribution of muscle involvement in myopathy. And we must not go for a single protocol for all the myopathies. That is what I wish to say. Coming to the combination of the doshas. This is a famous slogan from Kasa Chikitsa by Acharya Vakpada, where he is mentioning that even though we know that Vata dosha is key factor in muscle function, we must give stress to the associative dosha as well. Consider the Yoga Vagito Vada. So in certain conditions, we are considering Kaba. For example, in facial scapulohumeral dystrophy, the associative dosha is Kaba, and in polymyositis and myasthenia gravis, Pitta is having involvement. Likewise, we have to change the methodology. While coming to Vadagoga due to Avarana, what is mentioned is that there may be no benefit to the initial Snehana or Brahmana that we are seeing in our clinic as far as myopathy is concerned. Patient is fit for Snehana or Brahmana, but it is not working. So we have to think about Avarana. So we have to start with Pajana and Rukshana. Kabahara must be followed by Vadahara. And in some cases, Pittahara must be there in conditions such as myasthenia gravis, which I have explained in the previous slide. One thing we wish to have in our mind is that every avarana may lead to Daduksha in due course, as explained by Acharya Charaka. Coming to Bhagya Ubajara, while giving Rukshana, we are also giving Bhagya Ubajara. We are not going for Uddortana. Instead, we are going for alternate application of Snehana and Rukshana. We are giving Abdinga with suitable Thaila, followed by Avagaha. After that, patient is applying Thaila, and again Uddortana is done. Alternatively, Rukshana and Snehana is given for Bhagya Ubajara. And also, we are using Jivandyadi Churna mentioned in Rajakshma Chikitsa for Ulsadana along with Shira. In a similar manner, we are also going for Ulsadana, which is explained by Acharya CISSA in Anagada Bada Pradesheda, where he is explaining that it is capable for producing Laghava as well as Prabha to the body, and also enhances the Brajaka Pitta as well. And we are altering the Dravadrivyas for Ulsadana as per the Dosha Anubandha. We are going for Kshira, Dhanyamra, when the associative dosha is either Pitta or Kapha. And also we are going for Ubanaha for the individual muscle with Jivandhya Dyoshashtiga. And we are using Mamsa as well while going for Ubanaha. Coming to Snehana, we are having a lot of example. I am giving one or two. For maintaining Agni, we are using Ardra Vibrata or Dadimadi. For Shodho Shodhana, we are selecting Shatpala. And the individual conditions also, we are having certain clinical data. Ugurithara and Karpa Sasyadi, we have tried in facioscapulohumeral dystrophy. In a similar manner, Kalyanaka and Shatpala, we are used in myotonic dystrophy. Valiyanarana thyroid, myasthenia gravis, as well as polymyositis, we have tried for Snehana. But many are not fit for Snehabana. In that, what we are doing is that we are giving Annavabedida Sneha in low doses, added with Lavana and Shara. Gradually, the dose is increased. Sweda must be given, followed by Virejana. Here, the yoga such as Ardra Grudha mentioned in Sofa, and also Buddha Pipili from Paichiratnavali and Gudartraka from Sofa Chikilsa is having very good effect in Mandatni Chikilsa of myopathy is concerned. There are certain criteria for Shodhana. Lot of criteria are there as per the localization of the disease, as per the category of Vada dosha. What I wish to highlight is that here we must not go for Vamana. If you are going planning Vamana, rule out the respiratory or cardiac involvement, which is usually seen in myopathy. But we have tried Sadhya Vamana and facioscapulohumeral dystrophy. I have explained Vada is much more dominant in such conditions. Coming to Shodhana, in Durbala, what we are doing there, Dosha, Nalpa, Puna, it is mentioned. We are repeatedly performing in a mild manner. And Sweda also conditional basis. In certain conditions such as myotonic dystrophy, patient is Anupasya with Sweda, where we are going only for conditional Sweda, Ushnajala Snana or something like that. In myopathy, the opted Shodhana is either Virejana or Vasti, and we are going for Nasya and selected conditions such as limb girdle syndrome or other myopathies. I am highlighting another area. What about the role or significance of Shodhana? We are going for everybody, the whole world is discussing about the gut microbiota, and certain studies have been highlighted with the relation with gut microbiota and the muscle health status. If it is proven the therapeutic charges changes from to Costa, then the Shodhana will be having much more efficacy as far as gut microbiota health is concerned. Coming for selecting Vasti, even Susajari is explaining, you have to assess even the sattva of the individual before fixing the Vasti. So dosha assessment needs to be done in every step. Bala and even sattva is to be assessed. We can go for either dosha, Hara, Samana and Brahmana. A lot of spectrum is available, and we can also go for Anivasana. Even we have tried Kala Vasti in myasthenia gravis with 5 Niruha and 11 Anivasanas. And you can go for any number of combination can be designed as far as Vasti is concerned. As there is scope of changing Kalka, Kota, everything can be changed. A lot of Vastis can be formulated after assessing the conditions such as Kala, Bala, Dosha, etc. And Vaidharana to Yavana Vasti is the spectrum for use. These all can be used on a conditional basis. We are using Bala Padolagi Vasti in myopathy. We have tried it in myasthenia gravis as well as limb girdle syndrome. And also we are going for Dvipanjamuladi Vasti mentioned by Vagbada. We have tried it in Becker's muscular dystrophy as well as limb girdle syndrome. Similarly, is the scope of Nasya. We are not doing Nasya in each and every myopathy, but what we are doing in myopathy is that we are going for alternate Snehana and Dukshana Nasya. And Pradhamana Nasya is having a great role. We have tried Rasnadi Churna and similar other Churnas. As Pradhamana Nasya is Bahu Doshavastha and Shigra Karini, which is the property of Churna Nasya. We have tried it in FSH dystrophy as well as myotonic dystrophy. And also many will be having associated psychological issues, which I will be going to explain. We have tried Avabida with Vilyadi in associated depression with muscular dystrophy. An alternative mode is very much ideal as far as Avarna Vada is concerned. It is mentioned that in conditions such as myopathy, same mode is bringing less relief. So we are going for alternate Snehana and Dukshana method as mentioned in the management of Kapha Avarda Vada. And Snigdhata is not providing relief as expected as far as my little clinical experience is concerned. So we are having a Ruksha to Snigdha spectrum in each and every treatment. I am trying to explain, which is starting from Uddortana to Shastika in Bhagyobachara, in Vasti, Vaidharana to Shiravasti. So for every treatment, we are having a Ruksha to Snigdha spectrum. After assessment, you have to go accordingly. That is what we have to do in such diseases. Similarly, the scope of Rasayana is very much as far as Dhatu metabolism here is concerned. It is an exclusive approach in such disorders which are mentioned as Duschigilsya. So as we all know the famous slogan from Apasmara Chigilsa by Vagbada, Tasmad Rasayana Duschigilsya Mubajire, IB is mentioning. And this is also affecting the Mahamarma. So we have gone for several Rasayanas which I will be explaining in the coming slides. We have used Nagabala Rasayana and Myasthenia gravis as well as facioscapulohumeral dystrophy. Pipali Rasayana we have tried in oculopharyngeal. Kanmada in Becker's and Duchenne's muscular dystrophy. I am not reading everything. Similarly, Guguri Rasayana is what I wish to highlight, which we are not usually using much in clinical practice. It is explained by Vruddha Vapada in Ashtanga Sangraha. Is explaining that it resembles Kanmada in use. We have tried it in limb girdle syndrome as well as Becker's muscular dystrophy. The administration is Yuddha Guguru. We are selecting Anubana with Vyadihara Koda, either Vedra Darvadi or some other Koda. We are using usually starting with 3 grams, increasing up to 15 grams and continue up to 21 days, 15 grams. And Virajana, if Vittavruddhi Lakshana is there, it is a very good Rasayana as far as myopathy is concerned. In a similar manner, we have gone for Kanmada as well, Gavida in Bhadra Darvadi or Dhanandra Koda. Here also, we are going for 3 grams to 12 grams with Vruddha up to 21 days. We have tried it with limb-girdle syndrome and Becker's muscular dystrophy. In a similar manner, we have gone for Guluchi Rasayana and polymyositis, which as we all know, it is an autoimmune myopathy. And also, we have tried Ashwagandha in myotonic dystrophy. In a similar manner, Rasayanas are having great scope as far as myopathy is concerned. And also, we have to stress on the dietary management. What modern medicine says that they are less active, prone to be obese. And if they are having swallowing problem, they may be having weight loss. So go for a moderate diet. It may not be hamper the acne and also devoid of amma. And also use of suitable ahara causing dosh, not causing dosha vruddhi is what we have to think about from the Ayurvedic point of view. In a manner, certain complications may arise. What is the swallowing problems? This may be, which may be usually associating myopathy. We have also faced it in motor neuron disease. There we have tried Swasa Chikitsa and also we have gone for Dubana. And also we have tried Udovasti, which is mentioned in Bhakta Rodha Chikitsa in Chikitsa Manjari. We have tried it for the swallowing problems in myopathy. And also we have to give advice on the safe swallowing techniques. They cannot take 90 ml Quada at once in such individuals. We have to advise them regarding the safe swallowing techniques. Also, they are having certain respiratory complications. This may be preventable to an extent and it is so important. Otherwise, there may be a chance of aspiration pneumonia and complication can arise. Here, yoga and pranayama is having a great role. I will be showing 1 or 2 articles. This article from Brazil shows the effect of yoga breathing exercises on pulmonary function in Duchenne muscular dystrophy. This was a significant finding from such a study. I think much articles are not seen from the Ayurvedic point of view, but yoga is having definite role. So for all of our myopathy patients, we are sending to our yoga center as well for improving the respiratory performance as well. In a similar manner, yoga is having a modulation of heart rate variability. As we all know, cardiac involvement is a complication of myopathy. So, modulation of heart rate variability is an initial indicator of cardiac involvement. So, yoga is having such an action. So, we can also send our myopathy subjects for providing yoga therapy so as to prevent the cardiac complication. As I am coming from the Department of Manas Roga as well, Manas is having great role as far as myopathy is concerned. The study shows that individuals will be having delusional as well as psychiatric disorders. So our psychological approach is highly helpful for the individual and psychological issues are the rise nowadays. So we are assessing the mental status of each and every myopathy patient. We are identifying the condition and providing support such as Sattva. Providing apt education about the disease is so much beneficial for the myopathy subjects. And also we are providing medicine as per the severity and presentation. I am not mentioning the medicines here. And also we are going for Nasi and Shirodhara for psychological improvement in such individuals. And that seems very much important. Atma Vanda is mentioned by Acharya Susuga in Pakshakata Chikitsa as one of the good prognostic qualities of an individual. Similarly, sleep issues we are facing in muscular disorders and we have to do techniques for sleep corrections have to be incorporated for getting better results. And similarly, physiotherapy is one of the better areas providing a lot of effects. We are going for multidisciplinary approach in myopathy. They are having a lot of benefits. I am not reading one after the other. They are capable of increasing muscle strength, providing balance, flexibility, preventing contractures, and help maintaining a good quality of life. So definitely, you have to provide your patients with physiotherapy provided after assessing the muscle weakness. That is the point we have to keep in mind. In such condition, definitely we have to better go for assessment. As there is no cure for conditions such as myopathy, definitely you have to use any tools available for each and every myopathy patient. Here I am going for an example, adult myopathy assessment tool, where you will be easy to understand what all benefits you get after your therapy. And many articles are having very short follow-up. So I have taken an article which is 7 years follow-up published from Pune by Narenda. But I wish to say that long-term follow-ups are needed while we are approaching or analyzing the benefits of muscular dystrophies. That is quite essential, and 1 or 2 years may not be sufficient in such conditions. That's what I wish to say. A lot of areas are yet to utilize as far as myopathy and Ayurvedic treatment is concerned. Here we are using Gomutra in many of our subjects, and that are providing benefits. The mode of action is yet to be explained. Gomutra Arka is having wonderful properties as far as this article. It is anti-diabetic, antioxidant, as proven in Mr. Albino rats. Likewise, many more drugs are yet to utilize or explore as far as management of Ayurveda and myopathy treatment is concerned. So coming to my conclusion, I have not mentioned any medicines. I am thinking to explain only the approach. Myopathy can be approached with Ayurvedic principles, that is quite sure. And the management is on a conditional basis. We cannot go for a general protocol for all the conditions. And multidisciplinary approach, as I have explained, is ideal. It may definitely enhances the quality of life, but there is scope, a lot of scope are there, but with limitations as well, as many of the inherited is having the genetic background. That is what I wish to say. That we'll be having a lot of problems while going with such management of myopathy. That is quite sure as far as Swami Vivekananda is concerned. If you are not coming across any problems, you are quite sure that you are traveling in a wrong path, say Swami Vivekananda. I thank the authorities for inviting me, and thanks for the patience here and all the delegates. Thank you, one and all.